Multiple choice questions are not just a test of knowledge. They are a battleground where your clinical reasoning and decision-making skills are put to the ultimate test. Can you navigate the complexities of patient care with precision and confidence? Did you know that approximately 70% of medical licensing exams, including the USMLE, utilize multiple choice questions, MCQs, as their primary assessment format? This highlights not only the prevalence of MCQs in evaluating medical knowledge, but also their critical role in shaping the future of healthcare professionals. In this video, we are going to talk about what multiple choice questions are, MCQs in short. Multiple choice questions, or MCQs, are the backbone of exams like the USMLE Step 3 and board certifications. But let's be honest, they can be tricky. Have you ever read a question and thought all of the answers seemed right, or none of them did? Don't worry, in this video, we will break down the concept of MCQs using the 5 key questions. I usually follow this framework of what, how, when, why, and where to understand any concept or try to explain any concept. Usually answering these questions about the concept will give you a very good idea and a solid ground about it. By the end, you will feel confident tracking even the toughest MCQs. So let's try to look into this and tackle this issue, and let's get started. Welcome back to the channel. I'm Dr. Sara Ahmed, an internal medicine and hospitalist provider, creating a video series intended to help USMLE Step 3 candidates understand high-yield material. But in this video, whether you are a medical student preparing for the USMLE Step 3 or an experienced physician getting ready to for your board exams, understanding how to approach multiple choice questions is a skill you need to master. In this video, we'll explain a couple of things. As I said, we'll follow the framework of what, where, when, how, and why. So we'll answer the questions what MCQs are and how they are structured, how to approach them strategically, when to use specific techniques for solving them, why they are important in medical exams and clinical practice, and where you will encounter them during your career. Let's dive into the details. And we'll start with the what question. What are multiple choice questions? The definition. Multiple choice questions are assessments where examinees select correct answer or answers from predetermined options. So you are required to make a choice that you consider the best answer from a list of options. Each question typically has 3 components. The stem, which is the body of the question, where they give you the story. The lead in. The lead in is actually the last phrase in the body or the stem. This is the question like, that's the area where it tells you the question. Like, for example, what is the most likely diagnosis? Usually this comes at the end of the stem. Or what is the next best step in the management? The third component is the options. A, B, C, D, and E, usually 5 options, which include 1 correct answer and several distractors. Plausible but incorrect choices designed to test your reasoning skills. MCQs are used because they test not only your knowledge, but also your ability to apply that knowledge to real-world scenarios. This makes them especially relevant in medical exams like the USMLE. So they test your knowledge, they test your clinical reasoning and decision-making skills in the exam. So how are MCQs structured and answered? So we know the structure, 3 main parts: the stem, the lead-in, and the options. Now that we know that MCQs are what they are, let's talk about how to approach them. I think that's where everybody is waiting for. Here is a step-by-step strategy. Number 1, read the lead-in first. Understand what's being asked to focus on relevant details. If they are asking about management, the question, you need to know the diagnosis first and the management second. So they are asking about this. If they are asking about the diagnosis, look for the clues towards that diagnosis and so on. So the lead-in is the first thing that you do in your strategy. This tells you exactly what the question is asking, and you can focus on the relevant details in the vignette. Then analyze the stem. Carefully read the clinical scenario, highlight key details like patient age, symptoms, lab results, and timelines. Look for red flags. I wouldn't say red flags, but important points, important clues in the stem, so that these point you towards the correct answer. Then one of the strategies or the ways that you can actually reduce your options to 1 or 2 or 3 options is to eliminate distractors, the things that you are sure are wrong. Okay? Narrowing down your choices increases your odds of guessing correctly, because eventually so many of your answers will be based on guesses because they are really close. Avoid overthinking. Trust your preparation and your first instinct. Overanalyzing can lead to second guessing and unnecessary mistakes. Answer every question, and this is very important. There is no penalty for guessing on the USMLE. So never leave a question blank. Answer every question. And this will lead me later to talk about time management, because we want to cover as much questions as possible. Remember, MCQs are designed to test your critical thinking. So it's not always about finding the perfect answer. It's about choosing the best answer in the given context. This is, by the way, is critical. Okay? You might have two very close correct answers to each other, but you have to choose the best one. So now we come to the when question. When are MCQs used in medical exams? The MCQs are the primary format for many medical exams, such as the USMLE Step 3 and board certifications. On Step 3, for example, the MCQs portion consists of multiple timed blocks, typically with 30 to 40 questions per block and 60 minutes to complete each block. Very important. You have the exam is divided into blocks, timed blocks. 60 minutes, 1 hour for each block. You need to complete whatever is included within that block, usually 30 to 40 questions. Timing is critical. You only have about 90 seconds per question. So practicing timed question blocks during your preparation is essential. You need to time yourself. You need to get used to being quick. This will help you build speed and confidence. During the exam, if you get stuck on one question, don't spend too much time on it. Make your best guess, flag it, and move on. This is very important. You have to put an answer. Don't leave it blank, because you might not be able to come back for it. But use the tools that you have available to you, like the flag. The flag is designed to indicate a question that you need to come back to later, because after you are done with doing all the questions, you have, and if you have time left, you have the ability to go back and re-evaluate and look at some of the problematic areas. Use the flags from the top of the screen to indicate these questions that you need to come back to. But don't leave the question unanswered. You have to pick some best answer that you think is the best one and move on. Don't get stuck, because if you are in question, for example, number 17, you still have maybe 33 questions, 33 more questions to do. You can't take 5 minutes or 6 minutes just on that question and deprive the rest of the block of your time. So be strategic about managing your time. If it's going to take too long, answer, guess something, put it and flag the question and move on, so that you can address the other more likely for you to answer correctly, or easy for you to answer correctly. Yeah, it will be unfair to spend all your time in one question and the time is ticking. And once you reach that 60 minute, it will lock itself. You cannot go back to that block again. Remember that. Time management is crucial. You can come back to it later if you have time. And time is one of the constraints during this exam. Now we go to the question of why. Why are the MCQs important in medical exams? First, they are directly relevant to clinical practice. These questions are coming from the real time, the real world. Okay, so whatever your thoughts are and your abilities are, these can be applied to the real world. It's an indicator of your abilities. Apply medical knowledge to real world scenarios and make decisions as a clinician. For example, a question might ask you to diagnose a condition based on a patient's symptoms or choose the best management step for a critically ill patient. Second, they focus on high-yield topics like cardiology, infectious diseases, and emergency medicine, areas that are not only frequently tested, but also essential for the patient care. Finally, MCQs allow for objective assessment. There is one agreed upon best answer. If you get it, you get the mark correctly. If you don't get that mark. This is very objective and very fair assessment. The standardized format ensures fairness in scoring and minimizing examiner bias. It's not an essay that includes some subjective feeling about it or something. It's a clear cut decision, right or wrong. You get the mark or you don't. So regarding where will you encounter MCQs? Actually, throughout your medical career, you will face them in all kinds of medical exams. You will see them in medical school exams, licensing exams like USMLE Step 3, and specialty board exams. They all use the same format. But their relevance doesn't stop there. The clinical scenarios presented in MCQ mirror the challenges you will face as a practicing physician. For example, a question about managing a patient with sepsis prepares you for similar cases in the ICU or emergency department. So, mastering MCQs isn't just about passing the exam, it's about building the skills you will need for a successful medical career. So, tips for mastering MCQs. Just like any other skill, there is an art and skill to it, answering these MCQs. So the tips that we can give you for mastering the MCQs include, before we wrap up, here a few tips to help you succeed. Number one, prepare wisely. Focus on understanding concepts rather than memorizing facts. This is, by the way, a universal golden rule in studying anything. If you understand the concept, that's a much better way of managing it during the exam than memorizing. Memorizing is never a good way of knowing information or getting information. Use high-quality question banks and review explanations for both correct and incorrect answers. This is usually the best way to study for any kind of MCQs-based exam. Question banks. Number two, practice timed blocks. Simulated exam conditions by practicing timed question blocks. This will improve your pacing and reduce anxiety and test day. Use the process of elimination. Eliminate wrong answers to narrow down your choices. Stay calm. Trust your preparation, manage your time, and don't let nerves throw you off. Answer every question. Remember, there is no penalty for guessing, so never leave a question blank. To recap, MCQs are the cornerstone of exams like the USMLE Step 3 and board certifications. By understanding their structure, practicing effective strategies, and managing your time wisely, you can approach these questions with confidence and improve your performance. If you found this video helpful, don't forget to like, subscribe, and share it with your peers. Let me know in the comments if there are other topics or strategies you would like me to cover. Good luck on your exam, and I will see you in the next video.